אחר צהריים טובים לכל מי שיש לו עוד כוח, כל מי שנשאר. אני מבטיח לכם שתהיה ארוחת צהריים טובה אחר כך. אז שווה להישאר, ולא רק בשביל זה, אבל שווה הרבה יותר להישאר בשביל מי שהאורח האחרון והמרצה האחרון שלנו. W.Block הוא Robert, I'll say it in Hebrew, and I promise that I'm not going to say anything bad about you. את בוב אני מכיר לא הרבה זמן, בערך 6 שנים. למעשה הוא הציג אותי לכל עמי ומי ב-Child Abuse בארצות הברית. ומאז אנחנו בקשר, ופתאום האיש החביב הזה, שבאמת כולם הכירו אותו, הפך להיות הנשיא של ה-American Academy of Pediatrics, ועד לפני כחודשיים הוא היה הנשיא המכהן. אז אני לא אקריא את הכל, מי שיכול לקרוא, אבל W.Block ניהל את בית חולים לילדים בטולסה, אוקלהומה, הקים את מרכז ההגנה בטולסה, אוקלהומה, שהוא מרכז הגנה קרוב לבית חולים, מבוסס הרבה על הנושא הרפואי. אם דיברנו כבר על הנושא של abusive head trauma, אז הוא וקרול ועוד כמה היו שותפים בכתיבת הצהרת מדיניות של ה-American Academy of Pediatrics בנושא abusive head trauma. והוא אחד מהמובילים והחלוצים בשטח של כל הנושא של Child Abuse Pediatric, שדרך אגב זו התמחות על בארצות הברית, מוכרת מ-2010, שאז הייתה הבחינה הראשונה של ה-American Board of Pediatrics. אז אני שמח להזמין, אני רוצה לראות בו חבר יקר ומורה. בוב, please.
Good afternoon. So for those of you who might have difficulty with English, we have a translator, and I used Google Translate for my title, so there's maybe an approximately correct Hebrew title there for you. What I want to do today is talk about 2 major categories that are important to all of us, regardless of whether we're physicians or lawyers or child welfare workers or law enforcement people. I want to talk about controversies that are present in the field of child abuse, and I want to talk about consequences. And that's an appropriate thing, I think, for closing the conference, because I want you all to leave not only with the information that you've gained during the conference, but also with a renewed purpose and sense that what you do is important not only for individual children, but for our societies, regardless of which countries we're from. So the controversies we're going to talk about will be sexual abuse, physical abuse, and neglect. Some of the physical abuse controversies have been mentioned, I think, so far in the conference. And the consequences, we'll talk about the adverse childhood experiences studies and the topic of toxic stress. And we'll also talk about a vision of the social determinants of health and some of the science that lies behind what is rapidly evolving as a very important new way to look at what happens to children and how that influences who they are, how healthy they are when they are adults. So let's talk about sexual abuse controversies first. In my career, and I think in Dr. Jenny's career as well, we spent a lot of time in earlier years worrying about discovering the anatomy and physiology and psychology behind child sexual abuse. and there's been sort of a shift now in the United States among child abuse pediatricians who are now talking more about physical abuse than we did sexual abuse. But it's always well worth remembering that child sexual abuse is a problem in most every country that I'm aware of. And we need to stay very vigilant because the effects of sexual abuse on children, who most often survive, can be quite compromising in their subsequent development. Physical examinations in child sexual abuse remain today, after a host of studies, showing that they're usually normal. And that's a very difficult concept for some people to understand, certainly for the general population who hear that children have been exposed to different kinds of sexual violence and still may have normal physical exams. It's difficult in the United States for juries to believe that. And it's also very difficult for health professionals who have yet to be fully educated in child abuse topics for them to understand that you can have, and most often do have, normal physical exams. There are also some examples where we see variants of normal, and in the past years, that's been a large part of the pediatric literature in describing the different kind of physical findings that we see in children that look different from absolutely normal, but really are just a variation of normal findings that we didn't know about before because we never looked. And then we'll talk about things that aren't normal but also are not abuse, things like a bruise versus a hemangioma, or changes in the structure of the hymen when the child relaxes, and other kinds of things that look abnormal but really are consistent with a normal finding. So I'm going to show you just a few pictures, and I always feel like I ought to apologize for showing pictures at the end of a conference and everybody's has all this information now in their head, and then we look at sexual anatomy. But bear with me, because this is an actual case of a 7-year-old girl who presented with vaginal discharge, and the discharge had some blood. And her exam, her first exam, looked like this, and I'll point out that she had a normal edge, she had a normal edge to her hymen. She had normal hymen tissue. I guess I'm not going to be able to do that successfully, am I? She had normal hymen tissue, and even though the when this first examination was done, it was done by somebody that we just mentioned without much experience, who said, well, she has this discharge and bleeding, but her exam is normal, so she should just go home. Well, it turned out that she was in a complex divorce relationship and being shuffled between her mother and her mother's boyfriend of the past, who was this child's father. And so she went home to the mother. The mother, though, was not satisfied that the exam was normal because the discharge went away, but the child continued to have soreness, and then the discharge came back. She came back and had a second exam, and it looked exactly like this exam. The second exam was my exam, and I had the advantage of this history. So we decided that we needed to do some further study, and we did a gentle probe through the hymenal orifice with a swab, a very small swab, which came back with grease on it. Now, I wasn't all that smart back in those days, but I knew that vaginal grease was not a normal finding. So we took her for exploratory surgery, and this is a picture of her. She's anesthetized and asleep, and the obstetrician who assisted us is holding in his forceps a socket from a socket wrench, which had been inserted through her hymen into her vagina and was rough on the edges and was causing the discomfort and the discharge that she had. Now you'll notice there's a hand holding the paper down here. I did not have privileges for surgery, so my role in this investigation was to hold that piece of paper which has her name on it, but I held it wrong, so you can't see her name. which is good because now I don't have to block it out. But you get to see my thumb, and that's important because you'll notice that that socket is about the same size of my thumb. And that went through, the socket, not my thumb, went through her hymenal opening, and yet she still had a normal opening. And the day after her surgery, we re-examined her. It's actually 2 days after, and here she is now with the exact same hymen. Now you'll notice that the vaginal cavity looks different. If we go back 2 slides, you'll see now that there's a lot of edema, and you're seeing the vaginal wall pressed up against her hymen, and that now has resolved. She again has a perfectly normal hymen, even though it was torn 3 times during the extraction of the socket, and is completely healed within 2 days. So this is just proof positive, and we've shown this to many, many juries, explaining to them that this is different from the case that they're hearing, but is a good visual example of how we can have normal exams even though there's been penetration. This is just a picture that is sometimes confused. Some people would think that perhaps this is the hymenal opening, but it's not. The hymenal opening, of course, is down here with the very thin part of hymen, a crescentic hymen. There's very little hymen or no hymen tissue up here. Again, a variant of normal that by itself has no meanings at all. I think you're all aware, if you're working in the field of sexual abuse, about septated hymens, which need to be explored because this septated hymen actually is a signal that she has duplication of her sexual anatomy. So she has 2 vaginal canals and actually could have 2 uteri as well. Now, here's a finding that's not a variant of normal, but may be a variant of sexual abuse, because this is a laceration, as you can see. Just dawned on me that this may be. I'm not going to mess with that. She has a laceration in the labia up at the top, and if you'll notice down at the very bottom, she has a little bit of labial adhesion, and I put that picture in to explain that the labia tissue actually goes all the way from the posterior fourchette way up into the clitoral region. This is probably a legitimate saddle accidental injury from a fall that would need to be witnessed and explained, and you'll notice that there's no other signs of bruising or edema or trauma around her vaginal opening. So those are just some examples of what we see in the physical exam part of sexual abuse, but I wanted to mention another topic that's not really a controversy, but is often overlooked when we talk about sexual abuse. As far as I am aware, there is no country in the world where child sex trafficking is absent. It seems to be a very pervasive and unfortunately growing concern, both a criminal concern and obviously a health concern for children and young women who are being trafficked and forced into a life sometimes of drugs and prostitution. And I found this figure while I was preparing this talk, that every week on the internet, there are 20,000 child pornographic images posted. 20,000 a week. Now, you hopefully will never see them, but there are folks who know how to access child pornography and use child pornography. And I think in the United States, we're seeing quite a bit of this across the entire country. No state is immune. I happen to live in Oklahoma. And the state of Oklahoma is sort of in the middle of the United States, a little bit south of the middle, but we have a very large interstate highway that runs east to west and another very large one that runs north to south. So we're a crossroads, and we're told that we're the center of the country for both drug trafficking and for human trafficking as well. So I wanted to make sure that I mentioned to you that this exists, and we all need to be aware of that and be on the lookout. Well, let's switch to physical abuse controversies first. The man in this picture is holding a rod that can be purchased on the internet, which is advertised as being a good weapon to use when you're disciplining your children. They call it educating. So when you're educating your children through physical discipline, you can use this rod because it is supple enough, supposedly, not to leave any marks. And it is recommended for use in babies as young as 2 weeks of age to teach them that they should follow their parents' directives without crying or otherwise being normal babies. So the question is, when children are disciplined through corporal punishment, is this beating, is it discipline, or what might it be? Well, I think that in the United States, at least, the definition depends on injury. If you spank a child and don't leave any marks, there's no sign of injury. And in most state laws, that's an acceptable form of punishment. In those same laws, though, encompass the fact that if you injure a child while disciplining them, that's abuse. So if you see marks, those marks are either bruises or they're linear marks. Some people don't buy a stick like that. They just use a ruler or fly swatter or something, and those leave marks, or leather belts. Those leave marks, and that then becomes abuse. We won't, but other people could argue long and hard that it is perfectly acceptable to use physical punishment on children, forgetting that the word discipline has its roots in teaching, not in child abuse. The differential diagnosis when we're looking at children who might have been abused is very, very important, because we need to have a consensus among ourselves on what is abuse and what isn't. Now, we all come with different levels of experience, so there may be some discrepancy on an interpretation of a finding. But then we should come together and talk about it and look for past examples to help educate us. Because there can be things that mimic physical abuse. Certainly, bruising from accidents can be an issue. Burns can be accidents, and they can be caused on purpose. Fractures can be a problem, and other lesions. As a matter of fact, on the airplane arriving just a couple of hours ago, I rode with a family who struck up a conversation when they found out I was a pediatrician, and told me about the woman's sister was a foster parent for a 4-month-old baby who was brought in through the hospital system in Arizona with 7 fractures distributed on the baby's lower extremities. And they were immediately prosecuting this as a child abuse case. And when the foster family was approached about doing studies to eliminate osteogenesis or other metabolic conditions, they argued that that would not be fair to the baby to do the tests, that this was obviously abuse. So I told my new best friend sitting next to me that probably the system would prevail and the tests would be done, and that was the appropriate thing to do to determine whether this was abuse or a congenital problem. So bleeding and coagulation disorders, metabolic diseases, and all other conditions need to be considered. So I won't embarrass anybody by asking questions, but if there were a question, it would be, do you think this child is displaying abuse, or could this be some other condition? Turns out that obviously it's an other condition. But we have to be very important, because when we take a child case to court, all of the possibilities that could look similar to our final decision of abuse need to be considered, and considered carefully. And that's a really good time to talk with each other and share experiences and make each case a learning experience. And that shouldn't be limited just to the doctors or nurses, the medical health professionals who are dealing with the case, but everyone else who's dealing with the case, because we need to learn together. Now, Dr. Jenny has talked to you some about abusive head trauma, I understand. The problems in the United States are where the controversy is. Now, there really is no controversy, but it really only takes one person to bring up an opposite point of view to create a controversy. And I'm troubled by the fact that we are trying science facts in courts of law. And with all due respect to lawyers and judges, that's not where we make scientific decisions on what is correct and what is fallacy. So expert testimony is a big problem in the United States. We have several people, and I think Carol explained to you some of their unproved hypotheses that they're promoting in court. And we have to be very careful that our prosecutors are very well versed in what to expect when some of these well-known, I refuse to call them experts, but when these well-known defense witnesses come to court. I don't know how many are traveling internationally beyond perhaps Great Britain and the United States. We're beginning to see them in other places. Sweden has just had one particular defense person show up. So we have to be careful about the false experts and the false hypotheses, and we have to understand that there really isn't any new science. There are just new hypotheses that stray from what has been proved over and over again in the literature and will continue to be proved because we're driven by being able to face this controversy and put it in its right place. I want to talk just for a second about child neglect controversies and say to you that there's really only one controversy in neglect, and that's in the definition of neglect. Because we have to deal with other issues, poverty being one, and I'll talk about that in a moment. Education that isn't up to par, so that the parents are sending children to schools that are not as good as they ought to be. And I bring that up because that's true in my home state. The public education in the United States is very different from one state to the other. When we compare education systems among the 50 states, Oklahoma is either 50th or 49th. So it's not child neglect on the part of the parents if a child is not being properly educated. I would maintain that it's a political system neglect of children and something that we need to address perhaps in a different way. Lack of access to medical care. Almost everybody in our country has access to care, but some of that access is not easy to come by. So although they may have a government program like Medicaid to help them, they may live in an area where there aren't very many doctors who will accept that form of payment. Hunger is not a sign of neglect unless the parent is spending money on everything else except food for their children. And shelter and clothing is a big issue. And I'm going to make an assumption based on some data I'll show you in a minute that that's not limited, obviously, to just a few places and includes issues for Israel. And here you are. Israel, I'm told, has now bypassed the United States and leads Western countries when it comes to child poverty figures. Child poverty has grown in this country by about 50% since the late 1980s. And about a third of children are now living below the poverty line, and several of those have been added to that list in recent years. Now, one of the things that troubles me is in my country, where we have about 22% of our children living in poverty. So when the United States tries to sound like it has solved all of its problems, we need to remind ourselves at home that 1 out of every 5 of our children lives in poverty. And among that number of children, half of them live in the United States at below the 50th percentile for poverty. So they are in deep poverty, which means that they are in deep trouble in terms of medical and health care. They're in deep trouble in terms of nutrition. And poverty is an issue that we'll revisit before this talk is over. But it's something that is not a child abuse issue, again, in terms of parents and families and children, but it's something that we have to be alerted to in the work that we do. Well, let's switch to consequences. I want to mention the Adverse Childhood Experiences, or ACE studies, and I always ask this question when I talk about this topic. How many of you in the audience know the studies of Vince Folletti and Rob Anda in the United States that resulted in the Adverse Childhood Experiences study? How many of you know about those? Okay, so this is new information. I don't know about translated into Hebrew, but you can Google ACE studies and find the original work. or the American Academy of Pediatrics is working some on getting information out. And there's another organization in the United States hoping to become an international organization called the Academy on Violence and Abuse, an organization that wants to instill in all health professional education the concept of violence and abuse across the lifespan. We're going to talk about toxic stress and allostatic load, and I'll explain those, as I will, the eco-bio-developmental model, and the social determinants of health influenced by physical health and safety, and a new definition for mental health. So let's start there. I want to do away, as much as possible over a short period of time, with the term mental health. And I want to replace it with brain health. And there's a couple of reasons I'd like to do that. First of all, we look at cardiac disease, we look at liver disease, we look at pulmonary disease, but then instead of talking about brain disease, we talk about mental health, which sets it apart, as if we all walked around carrying our brains in a bucket by the side of the rest of our body. The brain not only is part of our body, it's a very important part that influences the rest of the body. So we wouldn't tell a person with heart failure or jaundice or asthma that they're bad, that they caused their disease, that their mental hygiene, the term from which mental health evolved, is somehow their fault because they didn't live right. And we wouldn't tell them that they have something different from other health problems. So if we talk about brain disease, then we can get rid of the stigma, we can create more access to treatment, we can create access to early treatment for our children so that they don't follow a trajectory of ill brain health for the rest of their life. And in the United States anyway, it also creates a method of payment for diagnosis and treatment, which is often now not done because the insurance companies say, oh, this child has a mental health problem, we just pay for health problems. Again, brain in the bucket by the side of the body. So what are we learning about brain health? We're learning about epigenetics, fancy word that just talks more about the level of what's happening with our genes below the usual double helix in DNA and RNA. So you might ask, in either English or Hebrew, wait a minute, what does epigenetics have to do with child maltreatment? Well, in a very simple form, child maltreatment, especially ongoing neglect, creates toxic stress. Toxic stress causes biologic changes in the brain, both through genetic changes and through hormonal changes, and now anatomical changes in the brain, and those changes cause brain health problems and also cause other problems within the body. So this is just a fancy slide, a diagram that sort of begins with the chromosome, shows the chromatin that comes unwinding from the chromosome. It further unwinds to expose DNA, and within that are genes that are either exposed or hidden. And epigenetics is the science that looks at when something happens that biologically affects that gene sequencing. The DNA stays the same, but the genes either become exposed rather than hidden, or exposed genes that are good for you become hidden, and you accumulate risk for other diseases. It's much more complicated than that, but that's sort of the level that I understand it, so I'm going to share that with you. It leads us to developing a model of human health and disease which looks at ecology, and I apologize, it's difficult to see. In the blue, it says the social and physical environment of a child, the ecology of a child. What's the science of the child's life course through childhood into adolescence, adulthood, and into older adulthood? Development goes across all of those parameters. But now that we have epigenetics and also a better biologic understanding of norepinephrine and cortisol and the effects on the brain and those effects on the immune system, the metabolic system, and other systems in the body, then that ecology of the social and physical environment, by affecting biology, becomes embedded and influences how the genome is utilized. So when we're seeing children who are being abused and neglected, we are seeing children whose brain health is being directly altered It is changing in the biologic factors and the anatomic factors, and those changes may be reversible early on, but probably aren't reversible later on, and can carry the child into adulthood with problems they shouldn't have had. This really just says the same thing over. So let me spend just a moment on allostasis and allostatic load. This slide shows some stressors on one side, major life events and trauma. There are individual differences on how that's handled among children as well as among adults. Some folks stay with allostasis, and you remember that stasis means it stays about the same. It's like homeostasis. So with stress, without stress, things stay pretty even. With other people, they don't adapt as well, and they end up with what's called now an allostatic load, which looks something like the next two slides. This is normal. This could be you, it could be me. We sort of have a normal response. We become stressed. That stress carries us up to a higher level. Then we come back down. Then we go up again with another level of stress. But this is really allostasis. We keep coming back to normal. This is what happens with children who are exposed to toxic and prolonged stress without any family nurturing, which builds resiliency. There isn't a country in the world where children aren't exposed to stress from outside the family, be it wars, be it famines, be it whatever it might be. But if they're embedded in a nurturing family, then they look more like the up and down graph rather than this. But if the family is the cause of the stress, through abuse, through neglect, through domestic violence, through drugs or alcohol, then the child has this prolonged response. There's no recovery, and that's when the genome begins to change, when norepinephrine and cortisol are released abnormally and affect brain biology. So what are some of the causes of this toxic stress? Well, when you look up and study the ACE studies, you'll find out that they looked at physical and sexual abuse, they looked at emotional or psychological abuse and neglect. And again, neglect was used in their studies to define a severe situation that's not amenable to easy remedial services. They looked at violence in the family, interpersonal violence particularly, family, neighborhood, and community ecology. In our medical school now, when I'm teaching medical students and residents and they present a case, they now know that the first thing they have to present is not that this is a baby with ear pain or a baby with a bruise or a baby with a stomach ache. They have to tell me about the ecology of that child's living experience, and then we talk about symptoms. The ACE studies looked at drugs and alcohol and even the loss of a parent and the strain that that can put, or the stress that that can put on a child. And they came up with this pyramid, which is from the ACE studies, that looks at the adverse childhood experiences, or the ACEs, disrupting neurodevelopment. They didn't know that when they did the studies. That's now been added, that the neurodevelopment actually is the biologic factor that leads to social, emotional, and cognitive impairment. It leads to adoption of health risk behaviors like smoking and drinking and obesity. It leads to disease, disability, and social problems, and often can lead to an early death. So in this trajectory from conception to death, the effect of allostatic load and toxic stress has measurable biological risk for all sorts of health problems later on. So this says, what are your thoughts? How do we achieve success? We have to recognize these as issues. And Yoram, if I'm watching right, we're getting close, right? So I just want to brag for a moment about the American Academy of Pediatrics. This organization in the States represents about 63,000 pediatricians, and we have members in many countries, including Israel. And the American Academy of Pediatrics is built on this agenda of health equity, a medical home for all children, and the profession of pediatrics. And the planks that you see above there are the topics that the Academy is working on in its advocacy work at the current time. So we have been addressing for about a year children, adolescents, and the media, and trying to understand the effect of media on children. We've been looking at early brain and child development related to the brain health that I've just been talking about. We're trying to learn more about epigenetics. And then just this year, we've added poverty and child health because of the increasing awareness of how poverty affects brain health as well as physical health. But it's not up to the doctors. This slide explains to us that healthcare determines only 10% of health, that 51% of health is determined by lifestyle or the ecology we were talking about. 20% or so is caused by the environment, and 20% is other biology. So when I, as a pediatrician, feel good after counseling a family and talking with the family, I have to remember that it's the ecology they go back to that will have a greater influences on their family and their life than I did. Now, I just wanted to throw in a couple of facts. One is that equality is not the same as justice. All parents have heard from their children, it's not fair. In English, when fair becomes a two-syllable word, it's not fair, then we know that as parents, we're in trouble with our children. So I like to talk about equality, and you'll see on the left-hand side of the slide, that's equality. There's a tall child on a box, there's a medium-sized child on a box, and then there's me. All three of us have one box, but I still can't see over the fence. If you look at the justice, the tall child doesn't need a box. The medium-sized child does need his box, and I get two. And now we have justice because we can all see the same scenery. So I want you to remember this. This is my take-home message. That's such a simple message, but has such profound consequences. Although in spite of all of our best efforts, not every child gets to be an adult, it is certainly true that all adults once were children. If you look at the pictures below, that's a father with his son carrying the ball. That's the same father, the same son, with the addition of a large dog, carrying a ball. And this is an indication that what happened to that little boy during his childhood significantly and importantly influences who he is as the adult man he has grown into. And that children who are living with fear and inability to understand what's happening to them, children that are living in poverty whose lives are literally being torn apart, have a very, very difficult time growing into healthy adults. This has an economic message for all countries, which means that when we have limited amounts of money to invest, we absolutely must invest as much as possible in children. In my country, we do it the other way around. The United States is one of the best countries in the world at fixing things that could have been so easily and less expensively prevented. So, you know, lots of people come to the States to get things fixed, but they wouldn't need to come. Or even if we're in the States, we wouldn't need to have these issues fixed if we dealt with them appropriately at the beginning of lifespan, where we're setting the foundation. So, to any question we might ask, the answer is always our children. These happen to be my grandchildren. So whenever somebody asks you what's important about the work that you do, why is it so important that we do this right, the answer is always our children. And I think that social comment is as important as any medical physiologic comment we can make when we're talking about child abuse, a real issue affecting hundreds of thousands of children every day around the entire world. And you are all to be commended, first for being here for this conference, and secondly for continuing the work that you're doing. Thank you for inviting me. Shalom.